yes, my name is Adam Forker. I'm the Director of Client Access at the DuPage County Health Department. And my focus is on a lot of our administrative and business functions, as well as a lot of our access to care functions, linking people to services, working with public benefits and things of that nature. So I'm very lucky to work closely with folks at the DuPage Federation for the last several years. I think at this point, I want to jump right in. I know time is of the essence, so I'm going to attempt to share my screen. And hopefully that is working. Okay, I think we are seeing what I'm seeing. So the testing question, I think it's important to know that the health department, off the bat is not actually coordinating and delivering testing itself. That's not been our role. A lot of our emergency response role has been focused on the disease investigation and the contact tracing. You hear a lot about that. A lot of public information and distributing PPE, other housing projects and advocacy that we're working on, but testing in itself is not something that the health department delivers. So I just want to address that kind of outright. But if you do go to our website, and I of course encourage everyone to do so, you'll see we've built out a ton of resources here with respect to COVID-19. And there's one page dedicated to information about testing. And so you can see here there is information about who should get tested and symptoms, as well as testing locations. Also, you can see here that we link to the IDPH website because IDPH has really been a primary coordinator of those testing locations through the governor's office and the statewide effort. The ones that we're familiar with regionally are listed here on the website. I think Aurora is probably the closest for most of us. And I think it's important, we've been working to get the state to commit to a community-based testing facility in DuPage County. That has not been part of the plan yet, but we continue to seek additional testing resources. Some good news is that some of our local FQHCs have stepped up and are filling that gap for us in DuPage County. So I know VNA, for instance, has started a program of testing, as well as Hamdart Healthcare. Some information was shared with us about the testing that they're all starting to be able to offer. And then of course, otherwise, going through healthcare providers and the health systems in DuPage is where we know that people can access testing. Of course, in all of those instances, what's hugely important is, before you go, making sure that you're coordinating and communicating, because we don't want to induce unnecessary risk of spread. So, in a nutshell, that's kind of, as briefly as I can, what we know about the availability of testing. We do want to make sure that we're using this opportunity to highlight the disparity information and with respect to COVID spread in DuPage County. And I think that's best done here on this page I'm navigating to now, which is our first one. You see our COVID-19 dashboard. And so hopefully this loads. It's taking a second to load all this information. You can see our primary dashboard here. Some of the data is still loading, but it will have the confirmed cases. There will be a map in here when this loads, total deaths, as well as breakdowns by sex, gender, just trajectory of cases by municipality. But really, there's all this information down here indicating the disparities that I think is what is relevant. So when we're doing the testing that's happening community-wide, the positivity and the cases that we're seeing, you can see the case rate, for instance, among our Latino residents is 4.8 times higher than that of non-Latino. And of course, it appears I'm having a little trouble with my website here. I'm going to try to refresh that. I don't intend to read each one of these off to you, but suffice it to say that you can go in here and you can see all of these breakdowns that we have, and we are seeing disparities, and so a lot of that you can check out those specific statistics on our site when you have the chance. I think what's important is, and I hear Karen say this a lot, it is a novel coronavirus. It's new, and in many ways we still don't really understand all of the ways that it spreads in communities and the way that it affects everybody. What we do know is there's been a lot of data indicating individuals with specific pre-existing conditions carries an influence. Of course, there's a tendency for those to already exist in a disparate way as well. And so, our communities of color tend to be more afflicted by those health issues as well. So things like diabetes, asthma, COPD, we're seeing that all of those have been more tied to severe disease experience with COVID. So I think that, that really ties in what we're seeing with the case rates and the disparity of that. And I think finally, I recognize I'm moving kind of quickly through this in the interest of time, but we do want to make sure that, everyone's aware. The health department is working to be, a primary public health source of information and guide to local businesses, whether that's in manufacturing or warehouses or long-term care, where we know there also tends to be some tie with, lower income workforces and socioeconomic status issues. And so we're really concentrating a lot of our guidance efforts into those sectors to keep them as safe as possible, because as you know, they've been dubbed essential workers. They're continuing to go to work. They tend to have lower incomes. And so we're very, very concerned about those populations. Sadly, we still do not have adequate PPE, protective equipment for those facilities and for those populations. PPE really continues to be essentially a crisis in terms of making sure that everybody has all of what they need to shore up those risks.